Welcome back, everyone. So now we are going to start our next session, and I'm going to hand it over to Alana Hine from the Southwest ACH Swatch to start us off. Thank you.
Thank you, Bonnie. Welcome to the first panel of our symposium. We hope you enjoyed our keynote, Shoma Saha. I have to say, I will always remember her words, sometimes bold and courageous is the most practical. Thank you, Shoma. I'm Alana Hine, Interim Executive Director of Southwest Washington ACH, and I'll be moderating this morning's panel. Before we get started, I wanted to remind you about some Zoom housekeeping. The audience is muted and your video cameras are turned off. You should only see the panelists. If you have technology issues, please put it in the chat. There's only the option to chat the panelists, not the entire audience. Our tech gurus, thank you, tech gurus, will see your chats and we'll get back to you individually, also via the chat. If you have questions for the speakers, please use the Q&A box and we will do our best to get to as many questions as possible. Both the chat and the Q&A function should be at the bottom of your screen. We're recording all sessions and copies of all slides will be available on the website after the third day of the symposium, www.washingtonach.org. I want to introduce our panelists. With us this morning are Mo Chada, who works with Healthier Here, Van Den Kuno, who works in partnership with North Sound ACH, and Keantha Duncan and Tommy Knapp, both of whom partner with Better Health Together. We'll post our panelists' bios in the chat so that we can get straight to hearing from them. I'm going to pose a series of questions and hear from each of the panelists. And I'm going to start, Mo, if you're willing, this first round with you, and then we'll start the other rounds with other people first. Mo, can you tell us, what does your work with the ACH look like, and how are you involved with the ACH? Can you unmute yourself?
There we go. Good morning, everyone. Thank you so much for having me. Very excited to be here. So as you've heard, my name is Mo. I am with Aziswa. I'm a Director of Health and Social Services with Aziswa, and we partner with Healthier Here and have been doing so since 2018. So just a little history on how we got together with Healthier Here. We first started linking up with Healthier. We met them through Center for Multicultural Health, and we got to learn a little bit about them. And at that point, they were very interested because we do serve a population of maybe about 200 to 300 people. They wanted to find out how we access social and health services through our community. We got engaged. We were smaller. It's a huge population, but it's really run by volunteers, and we already had 2 volunteers then. So it wasn't a very structured organization. But then we started working with Healthier Here. They started to ask us questions on how we access health and social services. And by doing that, we got into an agreement with them where we were able to get some funds from them to be able to reach our population. We had community events where we were able to garner we had those questions asked, how do people receive their social services and the healthcare services? We also were able to do some surveys for our community members. Once we got started, it was, it was just a straight going for us from them, with them at that point. We have been working with them from 2018, like I said, and right now we are deeply involved with the community, with Healthier Here. They have helped us so much in helping us to bridge the gaps through the health and social services for our community members. We've been able to reform our organization through the help of Healthier Here. We now have 4 volunteers right now working with people. We're able to get to people and get them to get services through the partnerships that we have made through Healthier Here. We were very fortunate to be among the people that were approved for the Catalyst Fund. And so we did get onto Unite Us, which is a platform that has been very, very helpful with our community members in making sure that we do close those gaps and people are receiving the services that they need. work with Healthier Here continues. I'm proud to say that I do sit on the advisory group for the CIE, the King County CIE, the Connect Community. I've been working with them from the grassroots and been able to gather information from our community members. We've done a lot of community engagement with their engagement partners. We've been able to bring voices from our people and bring them to their ACH. And that has made a lot of transformations. The equity itself, trainings on that has been very, very helpful with our population. So like I said, our work continues. We very, very grateful for the partnerships, for the doors that Healthier Here has opened for us and continues to do. We have met different partners through the engagements, the meetings that we have, the partner workshops, and we've been able to make those connections and help our community members. Right now, we do have a community that is aging in place. And so we've been able to access wellness clinics for our people. We've had the ability through Healthier Here to run clinics, to share COVID information. We were even able to run a vaccine clinic through Healthier Here, the partnerships that we have made that we keep forging ahead. So our work continues and we're very, very grateful for it. And I hope that it just continues to get better from there.
Thanks, Mo. Can we have Kantha and then Van? Kantha, what does your work with the ACH look like and how are you involved with the ACH?
Absolutely. Good morning, everybody. So I have the pleasure of supporting Better Health Together in their work in providing support services and affinity spaces for people of color, Black in particular, and other BIPOCs as well. And we have had over the last year and a half an opportunity to see in real time what the investment in communities of color directly can do. Some of the things that I thought about this morning as I was preparing for our time together is a few of the statements that people have said to me in those affinity spaces. One of which was from a young woman who has worked in the healthcare field for a while, and she is in a town that is a bit remote, and there are very few people of color in that town. And so as we were connecting to talk about really sort of how we're going to get through this time, what our specific needs in communities of color in the Black community in Eastern Washington, one of the things that she said was, I just need support and to know that someone is paying attention to what is happening to me and what is happening in terms of my health and my well-being, not just from the perspective of, I'm in the healthcare industry, but just from the perspective of I am a Black woman at this time and this day, and I am in need of someone to care for me. And she found those affinity spaces as being the place where she could receive that. Other things that we've also been able to hear and understand is the importance of relationship. That is so critical. Anytime you're talking about transforming a system, transformation does not happen without communication. And so communication does not happen, or I should say communication needs to work in tandem in building relationship. And so these spaces where we've been able to connect with people from our region and talk to them about their needs is, I think, one way that is immeasurable in how our ACH is actually working with community and building stronger partnership. The other thing that we have been really impressed with is the turnout for those who were seeking this kind of space. There is, as you all know, we're in the middle of a pandemic. We got the pandemic, we got all the demics, all the stuff going on, and people are overworked, over-Zoomed, overcommitted. And for us to see that people actually make the choice month after month to attend these affinity spaces, it speaks to the importance of having a space that is just for you. So it's more than just a meeting. It's more than just a group that you have to sign on to. This is actually a community. And so ACH's work to build community, to me, is why I'm involved in their organization. And I really love the folks over at Better Health Together. So it's been a pleasure working with them.
Thanks, Kantha. Van and then Tommy. Van, what does your work with the ACH look like and how are you involved with the ACH?
Well, kính chào quý vị That means good morning in English. And I speak Vietnamese to you. So that the sounds of the refugee and immigrants, when they come to this country and when you speak English to them, they don't understand what you're talking about. Just like I just speak Vietnamese to you, you probably didn't know what I'm talking about until I do the translations. So the work with ACH, early on I had the connection with ACH before COVID-19. But COVID-19 strengthened the relationship of my agency and ACH. And here the strengthened relationship starting. When the COVID hit, the refugee, immigrant, and migrant worker, that the one last on and first out. When they file for unemployment benefits because they immigration document, it doesn't fit in with our system. They claim been denied. They haven't get the money at all. I contact ACH and share with them my concerns and my worry because overnight I have hundreds of families standing out there in the parking lots waiting for food and some assistance. ACH never questioned me what I'm doing if I receive the funding. The message I got from ACH is, you go out there with the funding you get, you make sure the people put food on the table, and you make sure the rent got paid. Never one and doubt me on my actions and the work we provide for the RIM community, that refugee and immigrant. The trust ACH put it on us, no question asked, no doubt on us at all. That allow us to respond very, very quickly. We be able to get in and pay the rent within 48 hours for the people who had no money coming in because the unemployment benefits will not come too soon enough for them. And they are cut off, they redo, the restaurant shut down. And so this the relationship I have with ACH look like. We're building on the trust relationship. We're building on the support relationship. We're building on the community if one. If one person get hurt, it's all of us get hurt. That's what the relationship, that the working relationship I have with ACH. And how's my agency involved with ACH? Because we had a similar missions like ACH. ACH is standing there for the community, and my agency standing there for the refugee, immigrant, and immigrant and migrant member in our county, our community. We build a trusting relationship with our community member, just like ACH trusted us. And that's the reason why we be able to working with the community to make sure they access into the vaccine they needed. Make sure they got the PPE support they needed. ACH standing there and ready to distribute the mask, the face shield, and everything you can thinking of to protect our frontline worker, our essential worker, that's what we're calling them. Because of that, at today's, with ACH supports, we had a vaccine for BIPOC, refugee, and immigrant. We probably hit 5,000 shots by now, but the last time I checked in, we 11 people away from 5,000 people vaccinated in Snohomish, Skagit, and Whatcom County. We distribute 100,000 pounds of food. We distribute not $100,000 of rent, but very, very close to that. We prevent homelessness. We prevent the crisis in the RIM community. And without the trusting relationships I have with ACH, nothing will happen. So that's what the community need to have the organization like ACH stand by us, stand with us, and support us so we can support our community. And thank you very much.
Thank you, Van. Thank you so much for your words. Tommy, what about for you? What does your work with the ACH look like, and how are you involved with the ACH?
Good morning, everyone. I am actually the co-chair for the Community Voices Council, one of them, which is made up of people on Medicare, and we help to guide the ACH in their continuing work and provide resources and information for those that may need it as well. And I've been a part of this Community Voices Council since it hasn't been accepted. And I continue to serve for co-chair for maybe another year or so. And we're always looking for more people to join and to share their experiences. I joined as a lifelong Medicaid recipient and a disabled adult. So we're always looking for people from the various communities throughout Spokane to come and share their knowledge. Thank you.
Thanks, Tommy. Kenta, if you're willing, we'll start the second round of questions with you, and then we'll go in the same order. What's been going well with this work with the ACHs?
The number one thing for me, there's been a couple things that have actually been going well. The number one thing would be the open line of communication and accessibility. And when I say accessibility, I mean my ability to gain access to staff who support the work that I do in this community. So that's a big deal, being able to actually pick up the phone or send an email and know that you're going to get a response immediately and get whatever support is necessary to continue to support the community is, again, so just something that I value. A second thing that I think that's going really well is our ability to pivot in real time in the work that we are doing based on the support that we receive from Better Health Together. So if we are finding that there is something that is really working and we need to do more of that, turn the volume up or the heat up on that, we can easily do that. If there is something that we decide in our conversations, in our group conversations that, hey, we want to try this or we may need this to better support those who are in attendance, then we're able to, like I said, pivot quickly because there is not a lot of red tape to get through to get to answers or to solutions. And so that is really important. Anything that helps to strengthen that, as I mentioned earlier, strengthen that communication, strengthen that relationship, help to build the bridge to being a trusted messenger is necessary. We know that especially in communities of color and in the Black community, that there has been a historical sort of distrust of anything that says, reads, or smells like a healthcare system. And so for us to be able to really know that going into these conversations, know that going into this relationship and saying, we're going to be mindful of that, meaning if something happens, if we need to do something differently, if we need to support folks in a different way or a better way, we can do it. We can do it. And they understand why it's sometimes necessary to do that.
Thank you. Ben, you talked about some things that have been successful. What else has been going well with this work with the ACHs?
Going well with ACH is accessible to the funder. I never heard any funder telling me, you can call me anytime. Give me the cell phone number. That happened with Liz. She mentioned it to me. You can call me. You can text me anytime. And that accessible to your funder and share with your funder the need of community out there, because ACH trusts you as the message carrier. And when you receive the message and you know that is important, your funder need to know immediately. Unless you wait until quarterly reports and you put in the reports, that is the old news. And many lives will be affected because the communication gap right there. So the other thing that work well is ACH is stand by you and they trust you to do the work. I haven't heard any time ACH telling me not to doing it. When I relate the need to the community, ACH said, go for it and give me some more guidance to continue to doing it. So the quick response and accessible communication, that the key, it work and work all the time because the trusting relationship already built between the funder and the provider.
Thank you, Van. Tommy, what's been going well with this work for you?
Well, I'm happy to report that our committee has been expanding and we've become more and more organized as the years have gone on. And I've been here in the committee probably from the very beginning. So I have actually seen it grow and change and develop into what it has become now. And most impressively, I will say that we actually gained a significant amount of membership during this pandemic. So when you would assume that most people would be confused or something lost during this pandemic, especially with learning to use Zoom and other things like this, we see outreach from so many different communities throughout Spokane during this time. And our hope is that our committee continues to grow and goes on into the future that way. We also have begun equity training and an accompanying book club discussion to help us see the bigger picture within health equity. And thank you.
Thank you. Mo, what about for you? What's been going well with this work for you?
Again, I think I can relate to what everybody has said. Accessibility. Our ACH has been very, very, very good about us having direct connection with them. They've been with us, they communicate with us all the time. They have really helped us restructure ourselves. The transformation, our system transformation has been huge. Also, what has been going great with us is that the resources that they have given us for our community members, like Van had said, our community members at some point, they felt like, they were going to be homeless, they were going to have no food. But we have been given resources where we can reach out to members and help them. Hey, you're going to get dinner tonight if this is what you have to do. If you need to get to the doctor, you will get it because we're going to give you some gas money. They have been very helpful in us doing that. Another thing that I really appreciate our ACH for is the training that they have offered our community leaders. We have been able to go through the equity training. We have been able to go through a lot of the other trainings that they offer for our community members. As leaders, we take that information and we bring it back to our community members, and it has been received very well. Like I said, again, for restructure, our community has become very, very almost well organized. We've had situations where we call for our meetings and the meetings are able to come and the members are able to come. We have Zoom meetings because, again, we have had the resource to be able to do that. We have also built some trust in our leadership. I think that Keantha mentioned with the Black communities, there's always this distrust when it comes to anything healthcare or anything like that. With the immigrant population, it's even more so because we come from different cultures, and some of the cultures do not allow us to do certain things. But we've had situations where we've had trainings with people. We've talked about COVID most just as to give a reference, with COVID, we had a lot of pushback. People did not want to get vaccinated. People were not adhering to the rules, the social distancing and everything. But we were able to go back to our community members and really, really talk to them. We engaged members in our community who are themselves healthcare employees, workers, doctors in our community to come and talk to our people and come and educate everybody on COVID and the dangers that it stands for. We were able to bring clinics to them, talk about vaccines, answer questions, myth busters, everything that you can think of. And now our community is almost at a, I can't give you the real the real numbers, but I'm thinking that we're over 50% vaccinated, and the work is ongoing. We incentivize people that go and get the vaccine. We're always sharing information, so this work is really great, working great for us. Without the ACH, without Healthier Here, we wouldn't have been able to achieve any of these goals. So this is something that we really, really value and treasure. Thanks.
Thanks, Mo. Then if you're willing to start the next round, the question is, what could be improved?
That, Alana, this tough questions is short, but it's tough to answer. What could be improved? One thing come to my mind is I would like ACA challenging us to do more. Not like we don't have enough thing to do, but at the frontline worker, we normally try to put the fire out. And we had less time to thinking, a month from now or 6 months from now. And as the funder, ACH probably has the knowledge and seeing the need in each community and working with us and challenging us. Okay, Van, you do this. Do you think you can do this? And ask the other thing. So we make the continuum services, the whole services. And we don't have to have the client return back to us 3 months from now or 6 months from now. And they're heading to the road, become independent, which we're heading to that direction. But our job, most of us here, we normally taking the immediate need. So that happens every single day, every single weeks in our job. So I would like to see ACH challenging us.
Thanks, Van. Tommy, what do you think could be improved?
Well, so since I'm representing the Community Voices Committee, I will say that as with any committee, one of the most important things that we could improve is that we need to keep expanding and we need to keep adding people from the various communities throughout Spokane. And most importantly, we need to make it clear that we accept people with dual enrollments. So that is both Medicaid and Medicare. I have found within my time on the committee that very, very few average everyday adults are just on Medicaid alone. I'm one of the rare exceptions. So whenever we would try and recruit more people in the past, people would be automatically turned off or turned away because, I have both, I don't qualify, I can't do this if I'm on Medicare because you said Medicaid. So what we want to make this clear is that we are accepting everybody from all those enrollments. We just want your feedback, your lived experiences, and whatever you have to contribute for yourself or for your community. We don't want to hold anybody back. We don't want to limit anyone. We welcome everybody. So everybody who has something to share, who has, experience that could make this better, we want them on our committee. And so basically, what we want to do is add more people from the various communities. We want to make sure, and we want to, be more accessible to various impacted communities, especially throughout the pandemic. And we really just want to make it our purpose of this committee clear when we recruit people. Thanks.
Thanks, Tommy. Kantha, I see your hand. So with your permission, Mo, I'll go to Kantha first and then to you. Kantha?
Yes, I wanted to make sure I was able to answer this just in case it didn't get to me. Van, you are absolutely right in terms of what can be done to, I think, increase our capacity, by challenging us to do additional work. But the other thing that I wanted to make sure that was important, and Van, you touched on it too, is that we, what I would love to see happen is that there is a commitment to that continuum of care and services. So people right now, again, as I mentioned, this is crisis mode. You know, everybody is sort of dealing with the bigness of the world right now. And so there is some hesitation from folks that when COVID numbers go down, when vaccination rates go up, that this won't be critical work anymore. So providing affinity spaces won't be critical work anymore because, you know, the timing will change. And so if we could get additional just support and commitment from our ACHs that the work continues, I think that's what we can do, what can be improved.
Thank you, Kantha. Mo, what about for you? What do you think could be improved?
Thanks, everyone. For me, I think that what could really work in our favor, what could be improved is probably having somebody like me, not me speaking like me personally, but somebody like us to be part of the ACH. You know, if the ACH could have people who are like us and our community members can relate to them, they can know that they are part of the ACH and they're working there. And it is true, it is real, it is happening because there are people that can speak to them, people who are linguistically, who are culturally, seek services, understand the services that we seek as a community member. You know, it is very tough when you're coming from a background of communities, immigrant communities, so to speak. You know, there's a lot of distrust. You know, people don't believe that their voices are actually being heard, that whatever they say is going out there and it is actually being taken seriously. And this was one of the struggles that we had at the very beginning. And even when I myself joined, I was like, yeah, is this really even going to come to fruition? Like, are you really going to take my sentiments and take them there? Do I really matter? So having people in leadership, the ACH, people who are mimic, who can be somebody that they can relate to, somebody with a lived experience as a community members would really be good. Also, again, I did touch on a little bit about language. I know this is something that we're talking about. Language translation, people that speak a different language is a challenge. So maybe having people that actually speak that language would be a great help for our community members. Thank you.
Thank you, Mo. Tommy, if you're willing, I'll start this next round with you. What wisdom can you share about how to lift up community voice and how to partner with community?
Okay, thank you. Well, as I was saying before, I think it's important to expand into the community, definitely make an effort to reach these impacted groups and address equity within the groups that these impacted people, they can feel safe. And, you know, it's very, very important, especially these days, to show empathy, to have empathy within this kind of work. And, you know, just continue to do the work, continue to promote equity, and continue to learn about the inequities that are out there and how this actually impacts one's total health. Yeah. Thank you.
Thanks, Tommy. Back to you, Mo, if you're willing. What wisdom can you share about how to lift up community voice and how to partner with community?
I would say it starts with respect, you know, in our members. You know, it is being open, you know, understanding diversity with our partners, being very open and building trust in our community members, and then bringing it up to our partners. I think that having open conversations, being open to learn the different things out there are really huge. And bolstering that, being the example that you are when you're preaching something, you go back to your community and you are actually leaving that experience, so you're able to do it. I can speak like, say, for example, when we're talking about COVID vaccines in our community, it was a big deal. You know, nobody wanted to go there and do it. As leaders, you should be the ones to show by example. You know, I was one of the first members, our team members, like our board members were one of the first people to go out there and take the vaccine so that we can come and model back to our community members and say, hey, look, I'm still here. I'm not dead. I haven't turned into a monster when I come back there. So I think it's building trust with our community members, having openness, you know, talking about diversity and being open to differences, you know, talking to them about being open to differences and just allowing them to be part of the process with the partners. Yeah, that's what I think. Thank you.
Thank you for that wisdom, Mo. Kantha, what about for you? What wisdom can you share about how to lift up community voice and partner with community?
So this is very simple as well. It's, I feel like this is a simple day, or this is an easy conversation to talk about. But when we are thinking about how to move community work forward, especially in an equitable way, as Tommy mentioned, is so important. You know, we have to be willing to release power. Point blank. It is hard when you have the money to also be willing to say, while we have the infrastructure to help you do this thing, we have to also understand that we may need to fall back a bit so that you as community partners are able to step further and step closer to the work that we would like to have done. We have to trust you, back to what Ms. Mo said and Van. We have to have trust, and we have to share the space, Although you are the person, in terms of the ACH, is the person that is coming with resources, they also have to always be willing to say, okay, we don't have all the answers. We may have the resources, but we don't have the answers. And so what you bring is equally as powerful as the resources that we bring. And I think, you know, Better Health Together does a really good job at sharing that power and sharing that space, which is and always will be the basis of equity work.
Thank you, Kantha. Van, what about for you? What wisdom can you share about how to lift up community voice and partner with community?
Well, how to lift up community is take time to listen. Just allow community member to share with you what they struggle, what they success, what they failure, and believe in them. Don't judge them and say, well, you make up the story, you don't tell the truth or whatever. First of all, listen and believe. Then building the relationship with them and follow through what you said you will do. That's very, very important. You can listen, you can believe them, you can promise to the moon, but you don't follow through. And when you make a mistake, don't afraid to accept your mistake. And also celebrate the success together. Everybody will share the credits in this, everything you say, I do this, I got this, and things like that. No, we do it. We get it. We make the goal and things like that. So that's what the few thing I want to share. If you want the community strong, you want to be able to hear them learning, and eventually they can speak for themselves. And that's what the element you need to install in our community member, so they continue to carry the torch into the next generation and the generation beyond. So that's what the few thing I would like to share with the audience.
Thank you, Van. We have some questions from the audience. One of them is to you, Mo, in particular. Can you speak to Unite Us and how it's helped strengthen a community network of care?
Hey, thank you for that question. So Unite Us is a platform that is shared by different providers. You have people that take care of healthcare needs. You have doctors, you have mental health therapists, you have people that screen people for benefits. For my community in particular, it's been great because it is a one place that you go. It's almost like you go there and all the resources are there, all the partners are there. Our members, we found that, we're struggling in really getting healthcare, housing, food and stuff like that. And we would come to them and then refer them to different providers on the platform. And we're able to see in real time how those benefits are being administered to them. We can see the referral journey. We can see that from the platform, from the time that leaves my office and I refer to a different provider. Say, for example, I have somebody that is in need of housing rental assistance. I'm able to put in a referral for them. They'll contact the person and I'm able to see the journey and I can go back to my community member and find out how things are going and how I can help. So I like the fact that it's able to allow us as a community to be able to share those resources, to be referring out to those resources to people in our community. We don't have to go from one place to another. Okay, I'm going to go to Kent to go and talk about food banks, and I'm going to go to Renton and do this. Everything is on the platform. It is done in real time. The person gets the consent, signs the consent, and they're able to get it. So there's different types of services on there for your community as well. If you have a community, you can get healthcare services. Like I said, you can they can be screened for. We have a mom right now, a new mom that has signed up for WEEK, and they're able to get even housing and food in the same space. So this is how it has helped our community, and I hope that that answers your question.
Thank you, Mo. What would you say, this is another question from the audience, what would you say to providers or health systems or health plans to convince them that centering on community voice is important for their bottom lines as well as community health? Kantha, are you willing to jump in on that one? And then maybe Van?
Absolutely, absolutely. So the first thing is if you are in a relationship with a community partner or ACHs where you need to convince them of that, that's problematic, because I think that we should all see and know that if we do not center community, nothing works. And it absolutely affects everyone's bottom line. Everyone's bottom line. And so my hope is that you're not having to convince anyone of that. But in the event that you are, I think the argument that anyone could share is, let's look at ways in which we did not center community. Let's look at that and let's see what were the outcomes as a result of doing it that other way, because we have done it that way for many, many years. I think most organizations are really clear at this time in 2021 that everything evolves around community centering and partnership. And so I would, again, just hope that we're not still convincing folks of that. But if you have to, just let them look at the numbers. We keep a lot of data in all the work that we do. So go back and look at the data, look at the dollars invested, look at where there has been minimal change or minimal upstream, movement on any of the issues that we are addressing in our communities. And then there's your answer.
Thank you. Van, do you want to weigh in on this question?
Yes, absolutely. Thank you. The community, that's our bread and butter. You can live with community. The days you don't recognize the strengths and the contribution of the community, our country in big trouble. And we already see that through the COVID. You see the inequities. Because the housing program, education program, you decide who you decide for. The middle class Caucasian Americans. The system doesn't work for all. So COVID-19 bring out the inequity because the system, we don't listen to the community. We ignore 60, 70% of them and thinking you can just pull it with 30% of the people you think you provide services for. So community is very, very important. The voice had to come out from the community. We build the program from community voice. We implement the program based on community needs and community recommendation. We come back to community and asking them for more guidance and input. And so that's what we had to do. If we want to have our community strong, we want our country strong, and that's what we have to do from community.
Thank you. Mo or Tommy, do you want to weigh in on this question? We can go to the next one. Maybe Tommy, you would have a thought about this question. We have a question about educating people about Medicare and Medicaid with the community. What's your advice about doing community education about programs that can benefit people in the community?
My advice would just be, you know, to share as much information as you have. You know, reach out to people if they're curious and they want to understand more. Don't let these things confuse you, because it can get very confusing, and so I think really that's the best thing you can do.
Thank you, Tommy. This next question I'd like to ask all of you, if you're willing, starting with you, Mo, if you're willing. What's been most helpful to you in keeping you motivated and energized to do this important work?
It's the results. It's what we have seen in our community. It speaks for itself. I can't compare my community from the way it was, say, for example, even just 3 years ago, to what it is like today. The transformation is there for us to see. Our leaders have been educated. We have learned so much. We've had a lot of funding. We've had a lot of grants that have come to us to help us sustain our communities. We have felt a lot of trust in our members. A lot of people have received services that they needed, which would have never otherwise materialized if we hadn't had the partnership that we continue to do. And it is also the vision that we see ahead, you know, what we see coming up with the CIE that's coming up, Connect to Community, that's coming up for King County. We're very excited about that, because we know that that is going to be another resource for our community members, where they can go out and get those resources that they really need. We're teaching our people to understand who they are and to be proud of the people that they are, not to be apologetic for being an immigrant and being a person of color. So there's a lot that we are learning with our ACH. We're very proud to be in partnership with them. We're looking forward to growth. We're looking forward to many things to come. Our community it's revitalized. People are excited to see new things. That's what keeps me going. That's what keeps me going every day. The partnership, the people that I am learning from right now. I have learned so much from just these 3 members that are on the board with me. I'm hoping that I'll connect with them and learn from them and teach our community members other things that are able to advance us. That's what keeps me going. That's what keeps us working with ACH. So thank you. Yeah.
Thanks, Mo. So Van, what about for you? What's been most helpful to you in keeping you motivated and energized to do this important work?
Well, you know, I do have the down days. If I said every day it's you know, upbeat and everything like that, I didn't tell you the truth. I do have the down days. The days I had the down days is I had to dealing with people who put politics in front of human beings. And that happens, you know, quite often. But, you know, that's the thing I can deal with it. The thing that keeps me going every day is from the first time I met the family, you see the fear in their face. You see the scare in their voice. They're telling you, I don't know what to do. My family probably out on the street in a week or so. Then 3 months later on, the first month we stabilize them. The second month we begin helping them looking for the solutions. And by 90 days after, you seeing them, they don't look down when they talk to you anymore. They look at your face and they talking to you with confidence. The children running around you, happy, and begin kind of teasing you and things like that. And that's the pictures, it keep me going. On my desktop, I had a picture of the Afghan girls and holding her baby. When I pick her up at the airport, the girl is scared. And 5 weeks later on, when I come and visit her, she run out and carry her baby, and she wearing the clothes we're providing for her. Plus, she began saying few words in English to me. I asked her and her parents if they allow me to take the picture of her, and they said yes. And I had that picture I put on the desktop. The day I had a bad day, I look at her, and that keep me going. And I shared this picture with Liz, and I told her, this picture keep me going.
Thank you, Van. Oh, thank you for that story. Tommy, what about for you? What's been most helpful to you in keeping motivated and energized to do this important work?
Simply that I enjoy helping people. I enjoy helping communities. And really, I'd like to say that during this pandemic, this committee that I'm on, BHT, they have helped me, kept me centered. They have helped me stay focused, learning about the different communities and how this pandemic has directly affected them, different resources, and how we can help. Really, it's just helping others is the main passion I think that I have. And it's the main thing that has always kept me motivated since I was even old enough to understand what that means. So that's really the most important main thing for me, I think, is just helping and knowing that my help and the community's help is making a bigger impact elsewhere throughout Spokane and maybe even on the state level, So I feel good about myself knowing that I am part of something that helps make this change throughout Spokane. And it just makes me feel good.
Thank you so much. Kantha, what about for you? What's been most helpful to you in keeping you motivated and energized to do this important work?
I'm drawn to anything. If you actually want to get Keonth in the room, then say the word transformation, say transforming something. And that is what I am drawn to. So the idea that while we are working to transform this system, we are also changing and transforming people's lives, people's real-time experience. We're transforming the quality of life for people who are able to access support through the ACHs. And so that to me that's the thing that keeps me going. And like Van said, we'd be telling a story if we didn't have days that were tough. This work is tough and heavy. But knowing that if we keep going, if we keep pushing, if we keep supporting, that transformation will happen. And how we will see that is that kids live healthier lives, families have healthier lives, communities have healthier relationships with one another, and communities have better relationships with large systems. And so it is just the transformative nature of the work that keeps me going.
Thank you. So one last question, one more round. Tommy, if you're okay with this, I'll start with you. What kind of words of practical advice do you have for all the folks in the larger communities in Washington to help them keep their work going? We were just talking about, what motivates the folks on the panel, but what would you offer to them to help inspire them and help them stay connected to keeping their work going?
Don't lose faith, don't lose faith in yourself or in humanity or even in the different communities right now, because it's very tough. It's very tough. And really, the best thing you can do is to continue, reaching out, continue helping people, because you're not only helping yourself, but you're helping others, and helping others, you'll help yourself. So it's kind of a cycle, if you will. So, you know, in order to keep going, you just have to keep going. Basically, don't give up, don't lose faith. Yes, there is hard days, as we've discussed. There's going to be hard days, and there are hard topics. You know, there's been some work that we've done through the committee that's been, you know, kind of difficult to go through, but it's been necessary. And you learn and you grow so much through the hard things, but it also makes you appreciate the good things, and remind you that the work you're doing in your community, in your state, is good, and it needs to continue going.
Thank you so much. Mo, what about from you? What parting words of wisdom or practical advice would you offer that might help the other folks who are here with us continue their work?
Don't give up. Don't give up. Just keep going. This work does get heavy. We do have to have some very difficult conversations with people. We see things that are really, really difficult. Every day you turn on the news, you're going to hear something really bad that's going on in your community. Those should be motivators for you. You know, go out there. What difference can I do to make sure that my community is safe, is healthy? It is pushing on. When you're having those bad days, reach out to other members of the community, reach out to a peer, talk to somebody and see how they're faring. You know, having that, I know it can be a burden, you know, it can be really, you can feel alone when you're doing this. But this is why we're grateful for our ACH, you know, because we have been partnered, we have learned, we've met different community members. So talk to somebody, see how they're coping, and then come back, you're rejuvenated and you start all over. And then don't be afraid of the difficult times, because like Tommy said, those are the ones that will help you. Once you get over it, once you jump that hurdle, you go through, you've learned from it, and then you can go on. When you see the big picture, when you see the transformation, when you see things changing in your community, that will give you the wealth that you need, you know, the help that you need. You'll be really grateful. So don't give up, just continue. A healthy community is what we're all vying for. That's what we want.
Thank you so much, Mo. Kantha, what parting words of wisdom or practical advice do you have that would help people continue their work?
So I'll give one for people, as in the individuals doing the work, and then I'll give one for organizations, the organizations that are supporting community. For people, I think the number one thing to remember is that you're unique. You personally are unique. Your experiences are unique. Your voice is unique. And so if you were to step out of this work, then you're going to make some folks miss out on something really good that is in you, that only you bring to the work. And so definitely that needs to be the reason why you stay, because nobody else can do the thing that you're doing. And to organizations, I would say, you know, be committed, be brave, obviously, and be willing to be wrong. Be willing to have some times where you're going to have humongous, outcomes that are good. And then also be okay when the outcome is not, you know, we're really outcome-based society. So be okay when the outcome result is not as big as you want it to be, because it is working. It is tilling soil. It is planting seeds. And so it will continue to grow, and only your commitment to it will allow it to continue to grow. So that would be my advice for folks doing the work and organizations.
Thanks, Kantha. And Van, will you wrap us up here with your parting words of wisdom and practical advice to help people continue their work?
Well, you know what? My parting words is tomorrow will be a better day compared with today and the last day. It will never fail us, because if you think positive, you will get positive results. And don't afraid to reach out to the partner in your community and telling them what you need. 99% of the time, someone in our community, our network will step up to support you. Don't think you have to do it alone. alone is not involved in your vocabulary. You need to remember that. And don't afraid you fail, because we are human beings. We success 100%. We are the superhuman, and we don't need superhuman in our group. We need a caring human being. We need the human being willing to work, willing to respond to the needs of our community. That we need the human being, don't judge people, and willing to take risks. And that's my parting words for the member.
Thank you so much, Van. Thank you to all the panel members. This was an amazing hour. So appreciate your insights and your sharing your experiences, really reflecting and sitting with the words that you said about communication and trust and the focus on community. Thank you to everyone for being here for this panel. We now have a 15-minute break. Come back at 11 for a panel on COVID-19 impacts and the lessons learned. Thank you all so much. And we'll see you in 15. Thanks, everybody.